So today I am with Gayle Anderson, and she is a pharmacist at Dr. Gray's Hospital. Gayle, can you tell me a little bit about your paper?
So as a breastfeeding mum and a breastfeeding peer supporter, I was aware of a lot of poor information being given out by lots of different healthcare professionals. So when I came back after maternity leave, I decided as a pharmacist that I was going to do something about it. Luckily at the hospital we have access to the junior doctors training sessions at lunchtime, so we decided that we would run a small project around their knowledge around breastfeeding, prescribing and breastfeeding, and the sources that they can use. We designed this session around first of all a questionnaire that would gauge their baseline knowledge, and then we delivered the training session which focuses a lot on the importance of breastfeeding socially, economically, the importance to the mum, the importance to the child, and the importance to public health in general. About 6 weeks after the original presentation, we go back out with the questionnaires and we get them to fill them in again to see if their knowledge has improved, and thankfully it did.
So Gayle, why do you think it's important to embed breastfeeding into professional practice?
We've got some of the worst breastfeeding rates in the world in this country, and support is really important to improving those rates. The Lancet ran a series back in 2016 on the benefits of breastfeeding, and they estimated that around 820,000 child lives could be saved every year. 20,000 female lives could be saved from reductions in breast cancer, and also they estimate that there could be around a £50 million saving to the NHS annually. Additionally, and arguably most importantly, it really matters to mums that they are supported and are given all the help that they require when trying to reach their breastfeeding goals.
Gayle, can you tell me about any of the challenges around prescribing to breastfeeding mothers?
So the main challenges are around the licensing of products. There aren't any licensed medicines in breastfeeding mums, primarily because it's unethical to do trials in breastfeeding mums, so there's a significant lack of data. We do have retrospective cohort studies that we can look back at with regards to safety in lactation. Unfortunately, it seems to be that healthcare professionals think that it's the safest option just to tell the mum to stop feeding. Unfortunately, this doesn't come with any advice on how to maintain her milk supply, how to avoid becoming ill with mastitis, possible sepsis, breast abscesses, and also the baby might not take a bottle, so it can't be sustainable for many families. So sometimes it's just not the safest option at all.